Hey guys, welcome to the Explicit English channel. Due to the coronavirus pandemic outbreak, I have decided to make a video about the most common words that are associated with this disease. I also wanted to help you get yourselves familiarized with the COVID-19 vocabulary that appear a lot in the media these days. As a bonus, I will share a few safety tips at the end that can hopefully help you get through these times. So let's get started. So the first word that you probably hear all the time is COVID-19. COVID-19 has been classified as a highly contagious respiratory disease caused by a new coronavirus, which was discovered in China in 2019. And now from this definition, we can also talk about the word contagious and respiratory disease. So contagious means that disease is communicable or transmittable by a contact, whether it be direct from one person who's infected to the next, simply by just shaking hands, or indirect if the person who's infected with the virus touches an object and then transmits the virus to that object, and then the new person comes in and he or she touches the same surface of the object and gets the virus to their skin. Respiratory disease is a phrase that doctors are also using in regards to this coronavirus. And respiratory disease, in simple terms, please know that I'm not a doctor by any means. I'm just trying to simplify these terms for you guys so that you can have an understanding what they mean. Respiratory disease is a disease that affects organs that are involved in the breathing process, such as the nasal cavity, throat, lungs, chest, and everything else in our chest that help us breathe. Moving on. Another phrase commonly used is incubation period. Okay, this refers to the time period that includes a person's first exposure to a disease to the time when the first symptoms show. So what it actually means is that by the time this infected person host starts showing their first symptoms, from the time when they actually get this virus transmitted to their body, is this incubation period. Patient zero, this is another phrase that is commonly used. And the patient zero is the first person that has been identified with the disease in an outbreak. Okay? Screening is something that doctors use to see whether or not the patient is sick with this virus or disease. And the common ways to do the screening is to check the temperature or other vital signs. Okay, so these are the other three words that are associated with this disease. Let's look at three more words on this slide that are used to represent the advancement of the disease. So the first word is an outbreak. The word outbreak refers to a sudden increase in an occurrence of a disease. Okay. From this point on, we can have an epidemic. An epidemic pretty much means that the outbreak of the disease has spread in a certain community or a certain country and may have affected a lot of people. When the epidemic extends beyond the community or a country and spreads across a large area, multiple continents, or worldwide, then we have pandemic. The World Health Organization, also known as WHO, has declared COVID-19 a pandemic in March 2020. The second to last phrase we have for this video is flatten the curve. I'm quite sure you guys have heard this expression a lot, especially by the doctors. Okay, so let's explain it here by this diagram. Here in this diagram, we have this tall red curve, and this tall red curve represents the number of sick people if preventative measures are not taken. Then we have this green dashed line in the middle, and this line represents the number of people that hospitals can treat. Okay, and then we have this yellow curve that represents the number of sick people if the measures of preventions are taken. So this is what flattening the curve means. It's guaranteed, guys, that people will get sick because of this coronavirus, as we have seen, throughout the world. different countries reporting different statistics, right? So what we want to do, we want to take this tall, red curve, and we want to stretch it down. We want to extend it and stretch it out below the number of people that can be admitted to hospitals. That's what it means, taking this tall curve and stretching it out so that people who do get sick don't actually end up going to the hospitals. That's how we want to reduce the number of people, by taking these measures of preventions. Now, you may ask yourself, okay, so what are these measures of preventions? So you probably have heard the term social distancing, and social distancing means that we want to separate communities and people so that the spread of disease is reduced. Okay, some people call it social distancing, some people may call it physical distancing. So what we want to do, we want to, for example, keep at least 6 feet apart from other people. You don't want to shake hands, you don't want to hang out, you don't want to visit each other unless you really need to, right? So you want to be apart from other people, okay? The last word we have here is quarantine. And quarantine is a place or state of isolation, usually due to infectious or contagious exposure, in order to prevent the spread of the disease. Okay, so let's move on to the next slide, just to kind of recap everything we've said so far. I know it's a lot of words. So the first one was COVID-19. Okay, that's the name of the virus the doctors have given. Contagious, spreads easily, transmittable, either by direct or indirect contact. Then we have respiratory disease, meaning that this virus affects all the organs and tissues that help us breathe. Then we have incubation period, the time frame from when we get affected, to the time when we actually start showing the first symptoms. Patient 0, the first person that has been identified in an outbreak. Screening is a type of a testing that doctors perform to see who's affected with this virus and who's not. Outbreak, the sudden increase in occurrence of the disease. Epidemic, when it spreads across certain community or country and affects a lot of people. When the epidemic extends beyond the levels or borders of certain country and goes worldwide or affects multiple continents, we have pandemic. Flattening the curve, as I just said, we want to reduce the number of sick people so that not everybody goes to the hospital. Social distancing, keep away from each other for now. And we have quarantine, stay isolated, stay indoors. So the first COVID-19 safety tip is wash your hands for at least 20 seconds. Follow the government guidelines of the country in which you are residing. There is a lot of news out there, guys, and people are reporting random things. Make sure that your news are authenticated, and the best way is to try to follow the government guidelines and authorities of the place in which you are residing. Practice social distancing. We have explained that earlier. Try to manage your stress by exercising, even if it's for a little bit. I know it's hard for many people not to go to the gym. However, given the situation, try to stay at home. There are different exercises and stretches you can do on the floor. And if it's going to help you ease the anxiety or stress, given the situation, so be it. We have to do what we have to do, right? If you get sick, call your doctor immediately and explain your symptoms so that they can tell you what to do. They're trained professionals and they'll give you the best advice. Stay home. Stay home is really something that we can do for ourselves and our community so that we don't help spread this disease even further. Stay positive. In English we say there is a silver lining in every cloud. So, this will pass, even though if it's hard at the moment, but it will pass. You just have to stay positive and hang in there and give thanks. A lot of people sometimes just focus on the negative side and they forget how blessed they actually are. If you have a roof over your head, if you have food, if you have your family and your friends, people you can talk to, you are blessed and you can give thanks. I hope you found this video useful, and until next time, stay home, stay positive, and give thanks. Bye!